Okay, so thank you for inviting me on. Please, if something goes wrong with the PowerPoint and I'm not able to flip to the next slide, then please let me know and I shall try to correct it. I only have a laptop here, so I'm a little bit scared that it won't work, but this is how it is. Even many years after the pandemic, we are struggling with the technical issues of participating in this kind of meetings online. I'm very happy to present on this conference, and I listened into the presenters before me, and I was very happy to hear that it was more focused on the local everyday work with substance use and addiction, and the kind of way we have the possibilities we have to deal with them in everyday service provision. And now with this presentation, I want to zoom out a little bit and speak about if there's some sort of Nordic welfare state way of grasping substance use and its related harm. And now I'm turning to the next slide. Please give me a heads up if you, or say something if it doesn't work. So when we speak about a Nordic welfare society framing to these problems, what are we then referring to? So as you all know, the Nordic welfare society is based on a combination of various social theories and philosophical ideas. And they all aim to create an equal and inclusive society where all citizens have access to essential services and opportunities to achieve a good quality of life. And along the way, as we have developed Nordic welfare states, all sorts of ideologies have been, and ideas and concept has been embedded in this project. And those include social democracy, solidarity and equality, corporatism, the folkhemmet, or the people's home. It's not a good translation, but Keynesianism, humanism, social justice, etc. And what it is a social system or a structure in which we historically invest and integrate values, norms, and principles. It's also a social contract. It's an environment in which we live and act in the Nordic countries, or at least we have the same vision of that being the case. It's also a normative construction, which carries some specific meanings to us. We attach it to certain values of prosperity. It's a guarantee of security and equality, and we attach also the welfare state construct to the Nordic countries. And nowadays, it's also an object to relate for in political and ideological discussions, very much so that it's almost the main how could I say, the main phenomenon that we relate to in our political discussions. Should we try to save resources and draw down services, or can we use it for something else? And it's a struggle of resources. And last but not least, it is the framework upon which all of our research is built and based, and also our service provision. We are thinking that it serves certain roles in our welfare societies. So I'm just going to ask two questions during this presentation and try to a little bit discuss how I feel you could answer those questions. The first one is if there is a unique Nordic view and a Nordic grasp on the prevention and reduction of substance use related harm in the welfare state. Is there something that is typically for us in the Nordic countries? Then I'm going to also talk a little bit about the threats and this kind of epistemic struggles or struggles of views and what is considered knowledge and truth, and these struggles, how I see that they can perhaps be viewed as undermining this kind of Nordic grasp. And then I'm trying to, at the same time, through these two questions, I'm trying to come to terms with a bigger question, which is perhaps that is it today possible to be both pragmatic and critical at the same time? I know that in our area of substance use prevention and politics, there is a little bit of a tension between perspectives that are very pragmatic and realist, and then those that are more critical and wants to more perhaps question things. And I'm asking if we can combine them. The first question, is there a unique Nordic view or Nordic approach and a Nordic grasp on alcohol and drug problems and alcohol and drug use and alcohol and drug related harm? Well, I want to start with really from maybe the roots of how we view the production of knowledge as an interplay with political developments in the Nordic countries. And I think this tradition hugely stems from the Swedish figures, Alva and Gunnar Myrdal, who were very inspired by the research that was conducted in the US in the 1920s, when he started to look at statistically at populations and their habits and health, and how social exclusion and social integration could be seen in kind of larger statistical patterns. And they also went to famously to North America, and where they influenced hugely American sociology, and they were really targeting to look at national economics and social psychology of society, but they came to meet a lot of American sociologists and got very inspired and wanted to also establish sociology in Sweden. And this new kind of sociology, or this new kind of social science that would serve the Nordic welfare state, was a tradition that they developed and established, which is very policy focused and pragmatic. And they saw that social sciences can have an enormous impact on society, and that it's entangled with the development of the welfare state. But they also acknowledge a kind of contradiction, that how can research be very autonomous yet have this social relevance? If it only goes the errands of politics, then how can it be a free and autonomous research? And they found different ways to this as solutions for this dilemma, and saw that it's possible for research to be both autonomous and free academic research and still serve the public and the welfare state. So this is one piece of background of the Nordic way of relating to substance use and substance-related harm. Another person that I want to mention is Ketil Brun, who was a Finnish sociologist who, together with other people, presented in 1975 the alcohol total consumption model, which has been very, very important in the Nordic countries, especially in Sweden, Finland, Norway and Iceland, where we have state monopolies for alcohol retail. And it's a very simple statement. The more alcohol is consumed overall in a society, the more extensive the total alcohol-related harm and the greater the societal costs. And in terms of individuals and collective. So, but even if it sounds very simple, there's more to it than only this self-evident thing. And that is that the majority of people who consume alcohol in a very orderly fashion and don't go to the excessive consumption, we are as much responsible for the whole consumption, also that which is problematic or non-existing. So I have pasted in the prevention paradox normalkurva, which we say in Swedish. And you can never cut off a prevention effort so that you only target the high consuming and problematic population, but the trajectory or the curve can only move from one side to another. And this is also the basic idea in the total consumption model, which has been followed very much in the substance policies, alcohol and drug policies in the Nordic countries. So the background of the total consumption model was research on how power is distributed in society, who is able to influence what we think and how we treat people, and also new research on international drug policies in the 60s and 70s inspired this total consumption model. And Brun also advocated for transparent social policies and prioritization of common interests, which is very characteristic of the universalism in the Nordic societies. So the total consumption model was very important also for what we can call a sort of Nordic grasp when it comes to prevention and prevention of harm caused by alcohol and drugs. So there's a social contract, an idea of a social contract that is written into this total consumption model, which is that the citizens relinquish a portion of their freedom and power to the state in exchange for protection and coordination of common interest. And this is very much woven into these alcohol monopoly systems that we have in the Nordics. We think that it's a small thing for me as a consumer to go to Alko or to Systembolaget, but it can be crucial if everybody does that and we regulate the availability of these products. It can be crucial for the total consumption and the level of harm we see from this substance use in our societies. And in the 1980s, Finnish sociologist Pekka Sulkunen famously went out to bars and pubs in Finland, in Helsinki nightlife, and he interviewed people who drank alcohol about how they felt that the state was imposing on the availability of alcohol and taxing alcohol, and he came to see to understand the connection between the individual and the state, that they saw it as something very personal and intimate, that the state was talking to them and regulated them. So one can say in the Nordic countries, we have a very close relationship between the citizen and the state, and we see it as a personal relationship and a contract that we have made. And the state is, and the public sector is very much the ones who are responsible for taking care of alcohol and drugs and other related addiction-related problems and harms. So over time, this Nordic research and grasp on these matters have been launched through an institutionalization. In the 1980s, there was Ketil Brun and others founded the Nordic Council for Alcohol and Drug Research, and it's now merged into the Nordic Welfare Centre. And then there's a journal, which I'm the editor-in-chief for, which is called the Nordic Studies on Alcohol and Drugs. And it has this popularizing forum called PopNad. And then every second or every third year, the Nordic Welfare Centre arranges the Nordic Alcohol and Drug Researchers Assembly, which is traditionally a mixture also of practitioners and researchers. It's not only for researchers. Also civil servants often participate. And then the journal also gathers the Nordic alcohol statistics. So in these ways, the Nordic countries are doing cross-country comparisons and cooperating around these matters. So this is a kind of institutionalization of a Nordic tradition. Then I want to talk a little bit about what sort of threats or challenges or struggles are undermining this kind of Nordic grasp. And this, it's always a risk to talk about what has been and what is now coming, because you risk sounding very nostalgic. But I think we all agree that the views on what substance use problems are is evolving all the time, and so is our societies. First of all, we view the problems of alcohol and drug use. They really fluctuate over time. This is from my dissertation, doctoral dissertation from many years ago, when I looked at how addiction problems were framed in Finland in the 60s up until the 2000s. And in the 60s and 70s and 80s, people who used substances were a problem group that were these elderly men sitting on benches in Helsinki that were alcoholics, and or it could be drug use like psychedelics and cannabis used in more hippie environments or among young people, or more transgressive among jazz musicians and small rock and roll groups. So it was somehow on the margins, a phenomenon that was very social and connected to certain groups and problematic outsider groups who, in the margins, who needed to be somehow brought into the normal and cured or normalized and stabilized. But in the late 1990s, we started more in the Nordic countries and in this Finnish material talk about the addiction as a problem in itself. And it became a defect more in the individual as a problem inside the individual. And this also put a mark on how we see who is responsible for the problems. Is it the individual that is it the society who should cure it? Like in the 70s and 60s, we saw it more like they were expressions of that something is wrong in our society and we need to take care of these problems together through social policy and planning of services. But then later on, we've been focusing more on it as a medicalized or individual problem. After this, I've conducted more research on this, and there's the next phase in this development of views on these problems is in the later on when the brain science becomes more prevalent, and you talk about the brain disease model of addiction that has got more foothold in the public. So the division of responsibilities also shifts when we shift our understanding of what the problems are about. Another thing that has made our views on these matters more complicated and has affected how we view them is that the welfare states have grown huge. They are quite complicated. They have changed their models and the way in which we fund them, how we view the public management of services. And I won't go into this very thoroughly, but I can just mention that first, we usually talk about different or three historical paradigms of public management and service provision. And first, we have the very classic public administration, and notably, the Nordic variant has been that the executive sector, the civil servants, the service provision has had quite a great autonomy if you, for example, compare to the North American system. But then in the late 70s and until the early 2000 and still ongoing is this new public management, which is characterized by more private sector operators and more managing things according to marketization logic. And then now we speak about new public governance, which is more how that different organizations and institutions in the welfare state work together. You have contractual relationships, you see things more horizontally and try to manage, and this is also a reflection of the Nordic welfare state becoming such a huge machinery that the public administration is becoming more and more, it weights more, or it becomes more not inefficient, but more complex. So, and after that, even we have a suggestion from some Finnish researchers that maybe you could call it the new public integration model, that you try to integrate services together and see. So actually, we're going a little bit backwards if we see that in the 60s and 70s and 80s, you could conceptualize homelessness, mental health problem, addiction together and see them as part of the scope of the welfare state. Then now we are trying to fix what maybe our compartmentalized administration and governance has, brought with it, and we are trying to see them again as something that we need to take care of together by merging and synchronizing services. So the managing and organizing of the welfare state has changed. So the last thing that I'm going to show is some results that show gives an example of this complexity that we see in the Nordic states. We did an addiction survey in the year 2020 in Finland, where we studied the professionals in the Finnish addiction service system, how they view addiction problems, and how they think that the system should take care of these problems. And we had participants, almost 1,000 participants. and they were from different fields in this service provision. They could be involved in treatment or policy making or prevention and education and research. And they saw that there are at least two sore spots or pain points in the system now that we're trying to synchronize everything and merge it into a good welfare service system. First, they saw great challenges related to the division of labor and internal roles within the system. Who is responsible for what? You have the criminal justice service, you have the addiction treatment and substance use treatment provision, you have the general practitioner who's supposed to pick up the problems, you have politicians with their own agendas, you have NGOs chipping in and having their own role in the marketized service provision. And these role divisions and functions are still not articulated or thought through, and they might risk the service level and quality. Also, they saw great challenges related to accessibility and the system's readiness to respond when a person is trying to get help. So the respondents also emphasized the very value in a pluralistic view on the problems, that the system should be open for variation and people's different needs, and very much they saw also some kind of tensions between the social sector and the health sector. We also talked with them about very medical understandings of addiction, and also the brain-based paradigm, which is sometimes referred to the brain disease model of addiction. And they all agreed that it's relevant and important in itself, that this might be the reality. And when we compare to other surveys that asked the same questions, there was a great increase in support of this model. But on a closer look, they had a very dichotomous and splintered view. They expressed only support for this medical and brain-based addiction paradigm in principle and theory. They saw that it's really important as a possibility to maybe come up with future solutions, but mostly as a pedagogic tool when they are involved with discussions with clients who need to understand how their brain works and how their body works, and also for their view on their own responsibility and agency. But they saw that a great risk with neurocentrism and interventions that were neuroscientifically based, that could be quite risky and that were not had perhaps enough scientific base and also evidence base, but also that if you focus too much on only the bodily and anatomic failures, then would we understand the cultural and social context within which addiction problems come into being in our world today. Also, there were concerns about the weakening of the rights among the concerned parties, and saw that as a risk. So with this very, very shallow presentation, yes, I could say also that they feared medicalization and that this would sideline the social approach that they see was the more in line with how the Nordic welfare state has articulated its task in view of these problems. So I myself claim that there is a Nordic grasp that builds on this kind of social contract that the public sector has a very big role to play, and we view it as maybe something that we don't even think about in the everyday life in the Nordic countries. The challenge is to upkeep this kind of grasp in case we think it's important. Not everybody might agree with me. The challenges is that our views on the problems are developing all the time, and we are going perhaps towards such significations that is more distance from this kind of social policy grasp that we have developed in our countries. And still, I want to be positive and think that, like the Myrdals taught us, that it is possible to be very pragmatic and critical at the same time, and base our science on hardcore facts and hard facts, and still understand that we need to be very dynamic in how we interpret them and apply them to the complex problems that we focus on. Thank you so much.
Thank you very much, Matilda. I'm just going to tell you that you had a tentative audience here, since you weren't able to see us. I was just wondering, because we have a panel here afterwards and you're not going to be part of the panel, if you were willing to maybe answer one or two questions, if someone has some burning question in the audience. Is this okay?
Of course.
Yes, yeah. Okay. Is someone a burning question that needs an answer? Or not? Okay. It looks like you answered all the questions. I want to thank you very much for being with us, Matilda.
Thank you.
So you're not been able to experience Reykjavik with us some other time. Okay, so now we are going to have a coffee. Hope you have a coffee too. And thank you very much.
Have a great conference. Bye-bye.
Thank you.